at the macro level, there are many factors that impact on our healthcare system. And we can't, in this case, talk about chronic non-communicable diseases such as diabetes, hypertension, cardiovascular issues, and cancers, without looking heavily at the factors that influence them. And in the case of us in the region, as it is around the world, you realize that it's somewhat lifestyle related in many instances. So the foods we eat do impact upon our health outcomes. And the foods we eat are influenced by our accessibility to them, which of course relates to the pricing of them, which then by extrapolation relates to government's policy in terms of importation, rates of duties charged, or the subsidies that we charge, or the taxation on them. You may take alcohol and tobacco as factors that relate to NCDs. And governments, for example, say, look, it's not the role of the Ministry of Health to determine the tax rate on alcohol and tobacco. That's the duty of the Ministry of Finance to tax it. So you realize that this is really a whole of society approach that has to be taken. In our case in the Caribbean, where the majority of healthcare expenditure is going towards treating chronic non-communicable diseases, it's even more important that we take action. In Barbados, for example, we may spend $732 million per year in healthcare. And the indications are that maybe 60% of that is being spent on NCDs. So that then may come down to about a small economy like Barbados spending $210 million US dollars per year in a population just under 300,000 people on NCDs. Diseases that with a change in lifestyle, you can either avoid the onset of them or you're able to better manage your situation and live longer. So that's the perspective of it. In my case, I served as Minister of Health in Barbados for about 4.5 years. And during my tenure there, we had a very frontal approach towards NCDs. There's several things we did back then, quite frankly. One was to raise the level of awareness of NCDs. And that is such a critical factor because you cannot expect to treat the public healthcare issues like these without the public being aware that there is a problem. And then enlightening the public at what you can do at the individual, community, and national level to address them. So that the overarching theme was education, sharing information, letting people know the consequences and the costs of their actions. And then there were specific activities we did, such as we formed our drug service, we banned smoking in public places, we banned the sale of tobacco products to minors, tackled some of the issues regarding alcohol consumption. So it was a variety of factors that have led, I guess, in my case, to having that experience in the public healthcare system. But now in the Ministry of Industry, Commerce, International Business, Small Business Development, I think we have a pivotal role to play in helping to determine the health outcomes of the nation. If you operate on the theme coming out of the Bahamas Convention years ago that the health of a nation is the wealth of a nation, we have to realize that in order to get increased level of productivity in a small economy like Barbados, NCDs must be tackled. People must be healthy enough to work.